So today we're talking about stem cells. You might ask, why stem cells? Well, because stem cells are the precursors to all other cells in our body, which comes in handy when you're dealing with inflammation or dysfunction at a cellular level. Stem cells are undifferentiated, so-called progenitor cells. And basically, undifferentiated cells are like having a blank canvas, and the body needs to tell those cells what to become and where to go in terms of sites of injury or disease in the body. And I want to talk about cell fate decisions for the stem cells today, because this is about how does your body know where to direct those stem cells. And guess what we're back to? It's one of my ultimate favorite topics. So recent findings have revealed how mitochondria influence stem cell fate and function. So essentially, in terms of getting older, aging, and disease, it's our mitochondria that direct stem cells where to go in the body, and having good mitochondrial function is absolutely crucial to be able to heal and recover from disease. There are multiple studies out there showing the success of stem cell therapy for diseases such as ulcerative colitis, Crohn's disease, and other autoimmune disorders, including arthritis. But the problem with results is that even though people can get good results initially, the results aren't always sustained, because you haven't sorted out the issue as to why your body is not actually activating your own stem cells. For example, this one study in Crohn's disease showed that following stem cell implantation, people had good remission results for between 3 and 24 months. Personally, I would rather just focus on improving my mitochondrial function, in other words, my cellular health, my cellular energy, and my cellular voltage, and use particular strategies using light to activate my own stem cells. Because as we age, we just have fewer and fewer active stem cells. By the time you hit 30, you probably only have 50% of your stem cells that are active and useful for healing. And if you have inflammation and mitochondrial dysfunction, this in itself affects the stem cell's ability to heal. So I'm here today to say, if you would like to know how I activate my own stem cells, now that I'm in my mid-40s, and how I help others maintain their active stem cells so that they can heal too, comment STEM below and I will send you all of the details.